Thanks for the opportunity to be here, and thank you all for coming out tonight. Like Bob said, we're asked to talk about diagnosing pregnancy loss, and more people are saying we need to start saying, instead of pregnancy loss, we're saying pregnancy wastage. So if you see pregnancy wastage out there in the journals and things, you know it's the same thing. To me, it doesn't matter, but that's the way it is. So we're going to go through several things tonight. I want to start out with in veterinary medicine, at least, we're going to break pregnancy loss into two time areas. And the first one we call early embryonic death, or EED, and that would be typically a fetus goes through conception, is now a fetus, but it's lost before 42 days of gestation. And the reason we break them out into these categories is because if we think there's an EED thing going on, we're going to focus our investigation a little bit different than if we think it's an abortion. So true abortions are fetuses that make it to 42 days, but then are lost all the way up to calving at 280, 283 days. So that's abortion. And the reason I've got this on here is that sometimes we don't know if we have a stillborn, which would be a late-term abortion, or whether we have a weak calf syndrome. And again, as a veterinarian, we're going to focus our investigation two different ways, depending on if we have a stillborn problem or late-term abortion versus weak calf. And something you guys can do, guys and gals, is if you're checking your heifers or your cows and you come upon, there's a dead calf out there. It's been a while since you were out checking, you find a dead calf. If you want to know whether it's a stillborn, meaning it never was alive, never took a breath, or whether it was a weak calf, just take out a hunk of that lung and put it in water. And if it floats, that means there's air in there. And so you know immediately that it is not really a late-term abortion. Now we're probably dealing with a weak calf syndrome. So it's pretty important. Easy tool. Another kind of a take-home thing, pregnancy losses are normal in all species. All females that we breed and conceive are not going to maintain their pregnancy, some for short periods and some for long. I just looked at a lot of research out there to see what species people are actually researching to try to understand pregnancy losses, and there's everything you can see there, including pigs and turtles and of course humans. And I went back to 1960, I stopped there to 2020, and most of the research out there is looking at mares, cows, and humans. Those are the three species that are, these kind of losses are studied the most. This is a graph from a couple studies, kind of actually a combination of a bunch of studies, but gestation days here from 0 to 100, and then average pregnancy rate. And one study's the purple, one study's the black, and don't get locked on the numbers there, but just realize that we're starting with a lot of pregnancies over there at conception, but in a pretty rapid period of time, the first 30 days, we've lost a lot of fetuses. That's why the lines are going down. This study basically showed that they level off about day 30, and then our losses go way down. This study actually, a compilation of a bunch of studies, it went to 60 days and then falls off. And really the take-home message here is that most of our losses are going to occur in that first 60 days, 30 to 60 days. After that, we're still going to have some abortions, but the rate is usually, unless you have a major abortion storm, are a lot less than they are at 30 to 60 days. And that'll become important as we talk about diagnosing. So we talk about early embryonic death. If your heifers or cows are experiencing it, you're not going to notice it. Most of those fetuses are, well, they're all very small. A 35-day fetus in the bubble that she's in is half as big around as my finger. A 42-day fetus is as big around as my finger. So when they lose these size fetuses, a lot of those are just, they stay in the uterus, they dissolve. They basically become proteins and they're absorbed. But even if they're sent out through the vulva, you guys aren't going to notice that, right? They're so tiny, there's really no placenta, there's nothing. All you know is that this animal did not conceive when she should. Most of these animals are going to immediately return to estrus and rebreed. They're typically not going to become infected or any of those kind of things. We do know that, especially on the dairy side, that if you have animals that you know are in standing heat, whether you ate them or whether the bull was there, and if they have weird estrus length instead of our typical 17 to 24, if she comes back in heat like at day 34 or 35, that kind of gives you an idea that maybe she did go through an early embryonic death, because that extended her estrus cycle. So if you start having a bunch of those, we've diagnosed some issues by going in there and saying, yeah, we know that we've got EED. Causes, developmental issues. When we say that, we're just talking about a fetus that's trying to grow, but something happens, just biological attrition or genetics or whatever, and it quits growing. And like I told the group today, I'm absolutely amazed that these animals, just like us, we start out at 2 cells, then it's 4, then it's 8, then it's 16. Eventually the cells start saying, some say, well, I'm going to be a hoof, some say I'm going to be an eyelid, I'm going to be a heart, I'm going to be the valve in the heart. And it's amazing to me that all of those cells are doing all that stuff at the same time. And it amazes me that we don't have more loss. And there's only one time in my years of practice where, when I did a necropsy on an animal, that when I looked in there, I didn't see the organs where they're supposed to be. You know, the rumen's always on the left, we know where the spleen is, we know where the kidneys are, and it just amazes me that we have as little fetal loss as we do when all that stuff's going on at the same time. So that's typically one of the major reasons why we have early embryonic death, but BVD, and BVD can cause fertility, early embryonic death, abortion, lepto, neospora, and then human-induced. And I told the story earlier today that there was a group of heifers that were preg checked, 60 days pregnant. They were going to be moved to a different facility, so they intended to give a dose of 7-way blackleg vaccine. But a little bit of a language barrier. Somebody picked up the estimate, it was like lutalice, and then we had basically an abortion storm that went on. So humans can and do contribute to our early embryonic death. Okay, now we're going to switch to abortions. So we're talking those that are 42 days to term. And again, you may or may not notice that they aborted, because a 60-day fetus is about a length of a mouse, and a 90 days about the length of a rat. So a lot of those, especially those 60-day fetuses, there's not going to be a big placenta, there's not going to be a fetus. You might see a little blood on their tail, but a lot of these are not going to be obvious to you unless they're late term. A lot of these, even after 42 days, even up to 100 days or so, they'll return to estrus pretty quickly, because they'll clean up. Their uterus will take care of whatever the fetal loss was. But there's a couple diseases down here that have a tendency to cause a lot of infiltration of white blood cells into the uterus. And when they get enough white blood cells in the uterus, the cow, or the heifer of the cow, actually thinks she's pregnant. So she never returns to estrus. As long as that pus is in there, she thinks she's maintaining a pregnancy. So that's why if the herds that I've always dealt with that have a trick or a campy, which is the old term for Vibrio, it's the new term for Vibrio, those herds that have trick or campy, a lot of times the owner doesn't know they have a repro problem, because they're not seeing these animals recycle all the time. They're checking pastures because they're acting like they're pregnant, and the only time we find them is either when we preg check and we find a uterus full of pus, or it's calving season and these animals aren't calving. They should be calving, they're not calving, and it's because they've got a bad uterus. Okay, abortion causes, and there's tons and tons. It's a very frustrating diagnostic thing to get involved with, but there's a whole bunch of bacteria out there that can cause abortions. And most of the bacterial abortions are maybe 1 or 2 in a herd. You're not going to see an abortion storm due to most of these bacteria. It's just going to be kind of a happenstance thing. Mold is one of the most common diagnoses we get for abortions, and it can be anything from silage, hay, range cubes to cake. And they can either ingest the cow, or the heifer can ingest the mold, and then it gets in the bloodstream, or a lot of times they inhale the mold. Gets in the lungs, get into the bloodstream, and then it does some really, really bad things to the placenta. Toxins, nitrates, one of our most commonly diagnosed causes of abortion. And these are nitrate cases where the nitrate level's not high enough for the heifers or cows to show clinical signs, but there's enough in the diet to cause issues with the calf. And then we'll talk more about this later. Vaccine, and really it's the IBR in vaccines. The modified live vaccines can cause abortions, and the labels all say if you're going to use modified live vaccines on pregnant cows, that cow had to have had the same vaccine within the previous 12 months. And if she hasn't, then you run a good risk of abortions. And then IBR, it doesn't necessarily have to be the vaccine. I'm going to say most herds have IBR. Animals just keep them, it's a latent infection. Lepto is another major cause of abortion we find. We've got carrier lepto animals in the herd. Wildlife, we know deer are lepto carriers, so they can pass it through the urine, can contaminate a pond or water source, and expose our cows and our heifers that way. BVD type 1 and type 2. Now it's not like IBR, it's not in every herd, but we know that white-tailed deer can carry BVD2, so we know we've got some wildlife exposure to that. The reason this one's different is that BVD can be spread through nose-to-nose contact across the fence line, whereas the lepto, it's going to have to be ingested some way. And then the Ospera, which is it's more like a crypto. We're not going to talk about that. It's kind of controversial at this time. And then for us, we do diagnose quite a few protein, trace mineral, vitamin A deficiency kind of issues with abortions. Abortions and particularly weak calf syndromes. Okay, so this is a summary of the results from last year through our laboratory at K-State. It's about 300 abortion samples we got in, and this is the percentage of those that were diagnosed. So almost 30% were associated with BVD. So BVD's still out there. It's still causing some problems. Again, I've got question marks by the Ospera because it's controversial. So see, nitrates, 10% of those 300 samples we got in were nitrate associated. 6 were fungal, 6 were IBR. So those are the major players that we see abortions. And then these bacteria up here, where those bacteria I talked about are usually onesies and twosies. We just find them. They do cause abortions, but they're not something that usually causes an abortion storm. So remember this: 28% BVD, 6% IBR, and look at the year before was about 10% BVD and 25% IBR. So every year it's a little bit different. There's no way to predict the pattern. And the IBR at 25% basically has been that way for the previous 10 years. And what we have associated with, that's when the first modified live vaccine came out that had a label said you could use it on pregnant animals. And at first we didn't know. We found IBR in the fetus. We didn't know if it was vaccine IBR or whether it was field strain. But about 8 years ago, we developed the technology that we can tell from the virus. We can compare the virus in the fetus to the virus in the vaccine. And a very high percentage of those were vaccine IBR viruses. So we're hoping, the reason that it dropped off last year is because as veterinarians, we've done a better job of educating producers to say, don't use modified live vaccines in your pregnant animals unless those animals have seen the same vaccine in the previous 12 months. We're hoping it's going to stay low again this year. Okay. Diagnosing pregnancy loss. And this can be a real challenge. So if we're talking about early embryonic loss, we really don't have much to go on. A history, we can take serum samples from the dams and we can look at IBR, BVD, and lepto. That's about all we can do. There are some dietary things that we can look at, but we're very limited on diagnosing those early fetal loss cases. Abortions, I'm going to guess if you guys call your veterinarian and say, I have an abortion, if it's your first abortion, the veterinarian is going to say, let's don't spend a bunch of money or time chasing something because abortions aren't all that uncommon, right? But the more samples that we get from an abortion case or abortion storm, the better the chances are we come with a diagnosis. So I strongly recommend that even if it's the first or the second and you don't want to spend the money for diagnostics, if you have a refrigerator somewhere, you can put the calf and the placenta in the refrigerator. If they have to be frozen, that's okay. But more samples gives us more opportunity to help you figure out what the heck's going on. And the best, the gold standard for submitting to the diagnostic lab to figure out what it is the entire fetus and sections of placenta. The placenta is probably the most important tissue out there in order to help you with the diagnosis. Second best is if you're out here and you don't want to ship 60, 70, 80 bucks to get a fetus to Manhattan, Kansas to UPS, the veterinarians, and they know how to do this, they're going to take samples from every organ except for the intestines and send them to us. And it's really important that we get all those tissues plus the placenta. Okay, in a year, if we just look at years and kind of do a running average, if one fetus is submitted through our lab and the other labs around the United States that monitor this, we're only going to give you a diagnosis 30 to 50% of the time. Again, it's really hard to diagnose these. A lot of times the organism's gone. There's a lot of things that might be at play. And that's with one fetus submitted, okay? And fetus only. If we add a placenta, we're talking about a whole chunk of placenta, not just one little area, that increases your odds of a diagnosis 3 times. So again, the placenta is a really important tissue. I realize that sometimes you don't even know who aborted, or maybe she's out, you can't get her in, but cutting off a section of that and sending it to us is very, very important. If you send in more than one fetus in placenta, and that's what I talked about, saving that first or second one, you increase your odds of diagnosis 1.5 times. So again, more tissues that we have, the more likely we're going to give you a diagnosis. Something we deal with a lot is animals called pregnant. Now we find her open, or you guys notice she's cycling or whatever. Well, we don't have a fetus, we don't have a placenta. So what do? So one of the first things to ask is, when were they preg checked? If they were preg checked very early, in that 30 to 60 day range, we're gonna assume we know we're gonna have some fetal loss. If they're checked at 150 days, our losses should be really, really low. Okay, that's the first thing we want to know is when were they preg checked, at what stage of gestation. And then the other thing is, how good is the palpator? How good is the person sticking their arm in there with either the ultrasound or their arm, or I'll show you here in a minute, the test, the blood test or the milk test that you might use to diagnose pregnancy. As a reminder, when you have somebody out there preg checking, either you're preg checking your own or having a veterinarian do it, really we're doing it to find the opens, right? We're not there to find the pregnants. I mean, it's fun to say, I got 96 or 97% preg rate, but really we're looking for we want to find the opens. Because sometimes we want to resynchronize them if we're checking them early. Certainly we probably want to get them out of there so we're not using winter feed on them. And then there's all other kind of management reasons why you might want to do that. So this is a table comparing the pregnancy checking or examination techniques. So over there on the left are the test methods. So it's rectal palpation, which would be somebody's hand, ultrasound. So we're going in the same way, we're going to use an ultrasound visually. And then there's 2 companies that make a blood or milk test to look for pregnancies. And then this is just some stuff that tells you when you can start preg checking, those kind of things. But there's no test that's perfect. And so when we look at false negatives, we're talking about animals that we call open, but they're actually pregnant. So these are all about 1% or less. So they all do a pretty good job of saying, if she's open, then she's open. She's not pregnant. But where we get into an issue, and I'm I'm not dogging these blood or milk tests down here, but a veterinarian or somebody that knows how to palpate, we shouldn't really have any animals that we call open that are actually pregnant. Or we shouldn't have any animals that we call positive that are actually open. And same with the ultrasound, but you can see the blood tests, 5% of the animals that we're calling them pregnant on blood tests are actually open. So the best way to look about that is if you had 100 cows that you grabbed serum samples on and had a blood test on them, and the blood test said all 100 were pregnant, in reality, there's probably 5 in there that are not. And those numbers come from the manufacturers. So again, I'm not beating up these tests, these blood tests, because there is a reason for them, but experienced veterinarians are better than the blood tests. I know that, and I really believe that. Okay, here's one of the things that we really deal with a lot, lots and lots of calls. Had one today, got somebody I'm supposed to call back tonight about it. You've got somebody that you trust, they preg check, say, in October or November. Now you're starting to calve in March or April, and they're not springing. And so you have them checked, yeah, they're open. Well, again, we don't have a fetus. We don't have a placenta. We've got a long time from when they were checked pregnant to now. So there's lots of things that we don't know. So what are we going to do? And there's a lot of things we can't eliminate. We can't go back 5 months and look at very easily the genetic or the nutritional or the toxic issues that may have caused these abortions because of that lag time. And then the fact we don't have a lot of samples. We don't have a fetus. We don't have a placenta. But there is something we can do to at least eliminate the major infectious causes, the IBR, the BVD, and the lepto. And that's what I want to show you. And it's really easy, and it's not very expensive. But if we just take blood samples from 3 to 5 of those cows or heifers that are open now, and it's always good to take maybe 3 from pregnant ones, kind of a baseline, but you don't have to do that. But 3 to 5 of the open animals now, and then send them in, and we're going to look for antibody levels. And from those antibody levels, we can tell whether those antibodies are there from the vaccine or whether they're there from field exposure. Most of the calls that I get are because one sample was submitted from one cow. And it really is difficult to make any decision on that sample, so that's what I want to show you. So there's your organisms we're going to look at. We're going to look at IBR, BVD1, BVD2, and then in this case, one of the leptos. And these are antibody levels, and I'll just tell you from doing this a lot that looking at this number here, I'm thinking maybe we've got an IBR problem. I look at BVD type 1, I'm thinking we might have a BVD type 1 problem. BVD type 2, it's not high enough, don't care about it. Lepto's not high enough. The problem is it would be unlikely for a herd to have an IBR and a BVD abortion issue. So I'm pretty sure it's one or the other, but I don't know which one. And depending on what that is, I'm gonna do my investigation in a different direction. So I don't know what to tell the veterinarian or the producer on this. Luckily, they had sent in 3 more. So if we go across there at the top there, yeah, we've got this one that I'm concerned with. These numbers are low enough that 1 out of 4 with an IBR level of that tells me this is not an IBR problem. BVD, none of those are at a level that I would be concerned about, and then lepto's the same way. But the BVD type 1, we've got 3 out of 4 that are extremely high. So because of this, this was a case we worked with. They had a BVD type 1 issue in their herd, an exposure, and we were able to design a program to go in there and find out what the source was to prevent it from next year. A lot of this, we're not going to prevent anything from this year, but we're going to prevent things from next year. So it's just like the fetuses and the placenta. The more samples we get, the better off, but there's no reason to do more than 5 of these. 3 to 5 is plenty. We're looking for patterns. We're looking for trends. Okay, so how are we going to prevent pregnancy loss? It's very difficult, but biosecurity. We want to minimize the different strains, the exposure to different BVD strains, different IBR strains out there. And then just as a reminder that even an animal on the best vaccination program that has the highest level of antibodies, if they're exposed to enough of these organisms, those organisms will overwhelm the immune system. So we want to minimize the amount of organisms that they're actually exposed to. And then you all know a good vaccination program is really, really important. And these would be our baseline repro organisms we're going to vaccinate for: IBR, the BVDs, the lepto, and then the Campylobacter, which is the V on your bottles, like Shield Gold 6 DL5. The V is Campy, is what it is. They haven't changed the name. The best, at least in my opinion, the best advice for what vaccine to use and when is your local veterinarian, because we believe that there's geographical differences, and the local veterinarian really has the best idea of what vaccines seem to be doing a better job in most of their herds. Nutrition, immune system is a huge, it gobbles up a tremendous amount of proteins and energy just to keep functioning. And so it's really important that you test your forages and then have somebody that knows how to formulate the diet, have an appropriate mineral program, and all those kind of things. So summary, bummer, but pregnancy losses are normal. It's just biological attrition. Most losses are going to occur in the first 60 days. I mean, there's always some herds that have large abortion storms towards the end of gestation. Prevention is important, but it's not complete. There's only so much we can do to prevent these females from losing their fetus. And with that, I think we're going to the, whatever it's called.